same issue. Can you remember if you ate cake? Fruit cake. That's your issue, fruit cake. Fruit cake law. The range where you are safe. So it's no issue at all. Even when you get to use it again, it's no issue at all. Right? 80/4. And these are research based. These are, in fact, the medications where if you use a little above the normal dose that can cause issue. Many of these medications, if you use many, I don't want to just say, but if you use 2, 4 that you're not supposed to use, it still won't cause any issue as it were. Maybe medication that if you eat, they take the true process, true protocol, your HOD, head of department, will now sign. I approve of it before they can release it. That shows you how serious such medications are. But anti-malaria, nothing to you, sir. Shebo? All right. So the second question, the chloroquine. Those days it worked. Okay, you again. I don't know too. I don't know. Maybe those days, chloroquine was given. Were you taking the injection? The chloroquine, it was tab. The tab. Well, probably, like I said, personally from experience, I've noticed all these ACT too. There's a lot of resistance going on too. Do you understand? We are the cause. Don't forget I said we are the cause. When we use it, and this resistance, it doesn't have to be you. Once the medication is not working about 60% of people, then there's already resistance. But once in a certain fraction of the population, it's not working, then there's already widespread resistance. Do you get what I'm saying? So it's possible, and it's possible you are not taking it with paracetamol the way you should. Let me address that. When an anti-malaria is prescribed, anti-malaria will go destroy red blood cells. You know what is called blood? Blood has the liquid portion of it. It has the cellular portion. One of the cellular portions are red blood cells. We can't see them with our naked eyes, but they are red. They are the ones that give the blood its reddish color. Now, those are the things malaria parasites infest. Yegonoman targets, they enter them, infest them. So when an anti-malaria goes into work, it kills the parasite with the red blood cell that were infected. And do you understand what I'm saying? That's why no matter what, you lose some blood when you treat malaria, however little. It might not just be very, very much, especially if the parasite is not a lot. And if you are grown up. That's why in children, if they have severe malaria, which means a lot of their red blood cells has been parasitized, when they give them malaria treatment, their blood level might drop. So sometimes even in severe malaria in children, we transfuse with blood. Do you understand why now? Now, so when that is happening, it goes there, destroys the red blood cells that are infested with, and when it's destroyed, they release some chemical compounds, substance into the blood that will worsen the ache and worsen the fever. So that's why you must use paracetamol while you are taking anti-malaria. Because as the anti-malaria is working, the symptoms are going to get worse. And I've explained why, right? As it's destroying cells, those products that are being released into the bloodstream, they cause ache, they cause cytokines, pyrogens. They will cause ache, they will cause a lot of issues. So if you don't use paracetamol, it will be as if this thing is going from fry pan to what? To fire. So you have to sustain paracetamol 3 times once you prescribe it and use it while you are taking the anti-malaria. So you may not have that effect after all.
We have like 4 more people asking questions. So they will all ask the questions together. So that you can.
No problem.
Yes, sir. Yeah, thank you. Come, sir. Okay, Papa.
Praise the Lord. People are saying constant taking of drugs is bad. I heard it in the radio that so I don't know, sir.
Daddy.
Sir, there was a time my sister took amoxicillin and it leaves her to coma. So I don't know if amoxicillin is good for antibacterial.
Thank you, sir. I just thank God for your life because you have come to speak to us based on research and as a superman. But there's always room for supernatural, which not everybody can see it. I believe in science. I believe in drugs. I believe in divine healing. I believe in alternative medicine. it has worked for me, and you can see that even the government too, seeing the results, they are also investing. I don't know, you are a doctor and you should know, investing in alternative medicine. So I think we should look for a way to balance things up. Even when you look at the statistics, those one in the village, they tend to live longer, better, even than people that are taking drugs or that are taking drugs. Yes, you have already established that even the fallout or the limit of the drugs, taking synthetic drugs, that sometimes I have someone that because of the problem he has today, because he was taking, he took a particular drug which doctor prescribed, a recognized hospital, government hospital, because he takes that drug. So, and I've had a situation whereby even a person that is a doctor himself that say, go and if you get herbs, but he says that I know that I will not tell you this one based on my profession, but if you see herbs that can work, it works. So I think we should look for. I'm not saying that we should go the old way of, but government too, they are going to alternative medicine. Is there any way we can balance things up and still achieve a better health together with and what I still believe that your food, even if you are eating, you're balancing and well, okay, there's probability you will not sick and you may not need synthetic drug. I strongly believe in that.
The last question, sir.
Thank you very much, sir. Although I joined really late, very, very late, but thank you. Mine is not specifically a question, just observation, and I would like you to say more on it. I came in contact with some people who said, yes, they are sick with malaria and typhoid, and it's almost every month. Yeah, because I have the knowledge, I try to debunk that mindset that, especially for typhoid, because it's not true. They say when they do wider tests, and yes, that it is typhoid, and they are almost treating typhoid and malaria every month. Also, this is like sending you an errand because you talked about research. Can we please help women health specifically? And I'm being specific because I'm a victim of contraceptive. Yes, as I'm not someone that has a compatible contraceptive. So please help us work on that in the medical line. Also, what can we do about multiple drugs that are, I don't know if they are adulterated or if the quantity of what is written on the drug is not what is actually in the drug. I've taken diclofenac that didn't work up to what the paracetamol would do. I don't know if I should call it a fake drug or a low quality drug. And I've taken my daughter to the hospital, although private, but yes, recognized by an insurance company. She had a cough, and after taking that dosage of prescribed medication, including malaria medication, the malaria went while the chest infection persisted until I went to buy a branded medication. How do we work on these things so that we don't lose lives?
Sir, I'm sorry. Let me ask this. What could be the reason why when one eats, let's say, beans and bread in the morning, and you'll be having stomach ache? Do you get? And coconuts. I believe coconut is good too. So why would some people be eating coconuts and they will be having stomach aches? Thank you. Oh, sorry. There is one more person too.
Praise the Lord. My question is it normal for someone when the person is weak to collect drip. And when someone is being addicted to, whenever the person has a cough, is being addicted to Enzo, this Enzo cough syrup, and maybe later the person has switched to Tutolin, and eventually the Tutolin is not working for the person. He has to go back to what he has been addicted to. Is it good or is somehow?
Thank you for those questions. So I'll see how fast I can take them. The first question, constant taking of drugs. Who asked that? Okay. Like you, if I get it correct, you felt I said, I'm saying, come at Ogo. Is that the question? If there's no need, you don't have to. You don't have to. If there's no reason to visit the hospital, if you're living, if you're healthy, you don't have to. You don't have to. It's not like I myself so much love drugs, but when I have to, I get to. I don't know if you get what I'm saying. So I'm not saying let's go all out taking medicine. I'm just saying there's a provision God has made for our benefit. Let's maximize it and let's do it the right way. Do we get what I've said? So I'm not. And someone talked about amoxicillin and coma. Yes, amoxicillin is one of those medications that people react to, that give that allergy, and a severe one. Okay, so what must have happened must have been that the airway must have swollen up. The person wasn't able to breathe anymore, probably went unconscious after a while. So, well, it's not common. All these reactions that we're talking about, they're not so common. But once it happens, like I said, medicine is not perfect. So we have things like that. And if you read the leaflets for amoxicillin, they will write it there that in some persons you could have that. So, but once you've noticed that, then you stay away from it. So let's heighten our power of observation. Do you understand? Let's heighten our power of what? Observation. Many times, many of us feel things we don't even note it. We have a headache, we ignore it. So I'm sure the person must have, that wouldn't be the first time person is using amoxicillin, and the person must have had some reactions that he or she did not pay attention to. Or probably there were some other interactions. I can't say for sure because I wasn't a doctor who attended. A lot of things could have gone wrong. It's possible the person took something that they're not supposed to take with amoxicillin, and then you had the toxicity. Do we understand? But for precautions, the person should abstain from amoxicillin. I mean, when you talk about antibiotics, there are options. God is not a God who doesn't leave us with options. Do you understand? When you talk about cancer treatment, there are options. When you talk about antibiotics, there are options and the likes. Now, talking about alternative medicine, right? It's a lot of controversy, right? I know of an alternative medicine specialist in my church. I once gave a talk. The person stood up. Well, now, I will just do a little balance. There are herbal medicines that have gone through drug and selling. If you know what medicine entails, you will be afraid. About hundreds of thousands of potential medications enter the clinical trial. Only one come out sometimes. I'm just giving you an idea. Meaning many will be dropped. Many will be dropped because they go through very strict scrutiny. And it's for our safety. It's for our benefit. And I'm telling you sincerely, there are many of those medications that fail to scale through and they sell to us in the name of alternative medicine from China, from the likes. I've seen I will never support in the name of. So people who are knowledgeable, if you have the knowledge, use it. Let it guide you. And the person that even antagonized me, something bad even happened along the way. Sometimes when we talk, it's as if, you understand. I'm not saying medicine is perfect. And like you rightly said, divine healing is there too. I had a ganglion cyst back then on campus. And then if I had done surgery medically, there's a chance that it will recur. And I was in a program and somebody came, minister, I can't forget, and said, there's somebody here, you have a cyst in your hand, it's gone. I checked, it's gone. I did not believe. Because medically, it can go and come back. I waited and waited and waited. It's not there anymore. How many years? Do you understand? So, I'm a child of God. I'm talking to you. By God's grace, I'm a minister. So I'm talking to you from the biblical perspective, I won't lie to you. If we keep advocating on these things, what the definition of alternative medicine that you might have might differ from what the general public have. If I get you correctly, whatever is an alternative medicine that you claim government is supporting must be one. The fact that it's alternative medicine does not excuse it from the clinical trials I'm talking about, and many of them don't survive it. Many of them. Do you know that if they've gone through clinical trial, they've said it's approved, they release them, they still undergo post-marketing surveillance. That amoxicillin has been released does not mean they are still not monitoring it. And you can all recall, there's a medication we call ranitidine that we use for ulcer. Ulcer treatment. How many recall? Do you know it has been withdrawn since 2020, April 2020? Even though before it was released, they noticed it was safe, they felt everything was great about it. But they did post-market surveillance, and after they realized there's NMDA in it that can cause cancer. I've used the medication because I had ulcer sometime. I used it. They withdrew it. There are many drugs I can name that have been there. They approved it. They went through the stage. But later on, after what we call post-market surveillance, which is, even though it has undergone clinical trial and it has passed, they still keep monitoring it at the level of the consumers. Shotifa and Kaka for anybody. They realized one caused cancer and then withdrew it. Yeah, I want to go through scrutiny. Do you understand? How much more? Some things that go through some flimsy processes, and people just, and I'm telling you, some researchers are angry. You can also be angry when you do a lot of work on a medication and you feel that only benefit. You see many posts on WhatsApp, they will tell you that a doctor somewhere has discovered a cure for cancer and nobody is saying anything about it. Running. Angry researchers don't create that kind of awareness. Why? Because something along the line, like I said, nothing is perfect. Not even conventional drugs. And I've established that, right? So please, let's just stay safe. That's if you feel it's working for you, but with all that I've said, I'm sure you have been able to pick one or two things that should guide you. I mean, praise the Lord. Now, about the fact that people in the village live longer, it's not because one logo. If we talk about Lata, I can talk 10 hours on that fact. I've gone to what's this station, Tony OGTV, to talk about this. Their lifestyle. What about the things we are eating and they don't eat? What about the fact that every one of us takes shawarma and all suya every now and then now? What about the fact that those days we don't have access to Coke anyhow? But mo Coke growing up where tabashe party, ekolodun, ọjọ́ Christmas, kò tí ẹ̀ sí bottle ìgò la máa mú. Do you understand? And so, but now there was a time when I was working, I took 10 bottles of Coke in UCH a day because me ráyè jẹ màkàn gbàgbà ìyálẹ́gbẹ́ mò ń kọjá lọ ní ó yẹ mú wá 10. So you want to compare that lifestyle? There are many factors. Let's not go there. That makes the westernization of our culture, our lifestyle, our eating habits, canned foods, preservatives everywhere and there. But in the village they don't. They eat raw food, pankalo, kotama, muyenko, original vitamin, unadulterated. Do you understand what I'm saying? So there are a lot of factors. Not really about the fact that they don't take drugs. Do you understand? Not really about the fact that they don't take drugs. Now, malaria and typhoid, sick with malaria and typhoid every month. Who asked that? Now, there is something I should also address. Please let me spread the message. I'm going to do a video on it. Malaria and typhoid is not that popular. Do you understand? Typhoid is not that popular. As, in fact, I want to understudy typhoid, how it gained this popularity. I will need that advert. Do you understand? I will go viral if because between in all of that malaria. So malaria and typhoid. Now, first, there is no typhoid without tummy pain. There is no typhoid without a fever. So many times when people come and say, what's typhoid, yourself? Let's start from there. It's an infection of the intestine. Do you understand? So kokoro, Salmonella typhi goes in there and then infects the intestine, and then there is a problem and inflammation along the intestine. So there can't be a typhoid. We don't know as it were. There can't be typhoid without a fever. Let me tell you where the origin of this popularity now came from. There was a time where in the western coast we had an epidemic of typhoid. You know what I mean by epidemics? Because shewa to come out as a wave, and everybody is having it. So whenever there's an epidemic, it destabilizes the health system. Nobody anticipated it. So many things they use to address it, they are not verified. Like COVID. ẹ máa gbọ́ lẹ́nu wá ní pé ivermectin ní kẹ́ ẹ lò ivermectin òun wò covid ìyẹn tún máa lọ they will say azithromycin right it came unannounced so there will just be some quick research that will not stand the test. They will not have undergone all those things I talked about. They will just once they notice any little let's push it out. I mean, because so that was how wider test came. It came in the midst of an epidemic. But later, after the epidemic died down, they realized that wider as a test is not an accurate test for typhoid. It's not, in fact, it's only in Nigeria we talk about wider. I write exams or foreign exams. Nobody knows wider. And I don't know why we in Nigeria, we have a resistance to change. In Africa, I don't know. Do you understand? We have a serious resistance to change. Technology has moved on. Do you understand? We just still remain wider. Nobody talks about wider anywhere outside because in terms of how accurate a test is, we talk about sensitivity and specificity. Meaning, if there are 100 people that have typhoid, Melo, how many can it pick? Do you understand? It's very few. Meaning there will be many typhoid cases that will not even pick. Number 2, if we have typhoid, there are people that won't have typhoid and it will test positive. It will say they have typhoid, especially people that have malaria. Let me now tell you, there's something we call cross-reactivity, which means that test, if it sees malaria parasite, it will react. You can check it. So that's why it looks as if it's a common association, malaria and typhoid. Malaria, because why that test will react, that reagent will react and test positive when there's malaria antigen most times. So sometimes we call that false positive, which means that you don't really have typhoid, but the test is saying you have typhoid. That was the main reason they cancelled out that wider. But you know, many times patients don't even know. You got doctor talk about it, wider for patients back. Oh, good. Oh, doctor, wider and mufeshi, money typhoid. You know, sometimes you tell them you don't have typhoid. Let's look elsewhere. Do you understand? There are better tests to do if you think you have typhoid. Doctor knows. They can do a blood test, full blood count. They can do a stool test to look for the parasite, show one no stool and the likes. And when we do medicine the right way, we have the right result. Do you understand? Do we get it? So do we get why? Who asked that question? So have I been able to clear on that? Now, sick with malaria, I've addressed that. Women health, contraceptive incompatibility. I'm very sorry for what you've gone through. And a number of factors can explain it. Truly, some people don't tolerate some contraceptive methods. But I don't believe that one will not tolerate all. Now, let me also say that sometimes the contraceptives they give here, it depends on where you give it. So many things come into play. The storage, do you understand? The products, the efficacy and all. So if it wasn't stored properly, it might not work. That's why you hear of people, someone will tell you they're on contraceptives and they got pregnant. Especially for the strong method of contraceptive. You know, contraceptive methods are divided into strong, weak, but the strong ones, like the IUCD, that we put into the uterus, the implantable, and the injectable. Those three, they are powerful. You shouldn't have anything like that, but it happens for a number of reasons. So I believe you walk through the right place, okay, the right setting. They might walk you through and be able to decipher which one suits you best. And but the issue about adulteration of medication, sorry, I don't think it is what it is, right? This is Nigeria. But the advice I would give is, if you have money, go for the standard, for the branded ones. Somebody mentioned it, okay? I don't even joke in my own life. Once I fall in, I just go for the branded one. I feel it's more cost effective. At the end of the day, if you use one, it doesn't work. You use one, it doesn't, you know, but to a large extent, there are some brands we believe in that we know that when you use them, right, they're going to work. Probably because they are imported, and maybe because they have not been able, but trust me, I'm Igbo. Is there any Igbo person here? So, sorry, they still adulterate augmenting brand, Gaga. Do you understand? I've seen fake augmenting, 25,000, fake. But there are ways augmenting make you know. They put some label, some code that you will scan. That one they cannot adulterate. Do you understand? But if you are experienced, to buy color, You will know, this one, something is wrong. But may God deliver us. May God just guide us. Because even in the best of settings, sometimes you don't know. You may not be able to help it. It is what it is. This is Nigeria. I hope some people will arise, leaders will arise from here someday and do something differently, right? Talking about weakness and collecting drip, you don't have to. Do you understand? Because why are you collecting drip? Let me tell you why we give drip infusion. IV fluid. Do you know drip is just water and glucose? I hope you know. Because Kamaro pe babarani, especially when the doctor give me drip. Some people, you tell them you don't need drip. They say, doctor, I need to admit you need drip. And you now go and give testimony in church. Call the rope nkan to se o terrible. Wọ́n fún mi for drip mẹ́wàá sí mi lára. You know, omi lásán àti glucose ló gbà now. Come on. Do you understand? Now, what is drip? We give drip. Maybe you are dehydrated. Because of the condition you have lost fluid. Or because of the condition you can't eat well. And when we are administering medication, we need to give you glucose. You need to still have glucose. Do you understand? That's why we give drip, nothing more. So if you feel weak, if the weakness is a result of low water in the body, dehydration, then the doctor will assess you and feel they should give you drip. But if not, if you can eat well, you can drink well. What do you want? What are you looking for in drip? Do you understand? So you need to dissuade our mind. And I know patient can be funny. Go flush in Go flush in drip or flush system. What are do you understand? Is that okay? Don't have a flush system. Lo mumi pure water major. Go flush typhoid. You know it's a mindset, and that's why we are here, right? To relearn and unlearn. So it's a lie. Do you understand? It's not flushing anything. If you are dehydrated, you need water. And sincerely yours, when water is low in the body, sometimes it can cause some serious, especially in children. That's one of the most dreaded complications of diarrhea-related conditions in children. When they stool a lot. Before you say Jack Robinson, they're already very weak. And when the water is so low, it can affect the kidney. Do you understand? So aside that, if you are eating well, if you are drinking well, there's no reason to collect drip. Previously on Emzor, now I had to switch to another. I can't judge that because first off, Emzor and all those cough expectorants, they are not serious medications. They are not the main. Who asked the question? They are not really the main. When you have an upper respiratory tract infection, there's more to it than Emzor. Emzor is just like a supportive treatment. Would that be ulcer and you use antacid? All those mismatch. It's not the main. It's just to support. The main is to address the infection. So when you address the infection, some sputum may be produced. Just to help it come out, we now give you what we call cough expectorant. As the word implies, expectorant. It helps you expectorate. So there's nothing, don't make any serious association attachment, whether it's Emzor or Tutolin or anything. They're just cough expectorant. It's possible that at the time you were using Emzor and you felt it wasn't working, probably you were not taking the right antibiotics to address it, right? And probably when you now took Tutolin, that was when you used the right thing, and you now felt that okay, the Tutolin worked. And by the way, it's not even every upper respiratory tract infection that we give antibiotics. Sometimes it could be a viral. It could be a virus responsible, especially when there's no fever, there's no sore throat and all those things. Most times it's viral and it will go by itself. It's self-limiting. So when you see a doctor might just be, Nigeria man no antibiotics gone. Outside the country, they don't even joke it. They must be sure you really need it because they are serious about resistance. They are saying, we are not serious here. We are not serious at all. They are serious about resistance. So when you don't need, in fact, do you know there are criteria? You must fulfill some things, 1, 2, 3, 4, 5, before they give you antibiotics for respiratory tract infection. But yeah, doctor, ọ̀nà fún dùn mí, àárẹ̀ òdẹ̀ gbóná, ó ń ṣe mí, ó ń wú mi bí kò tiẹ̀ tí ì wú ẹ, ó kàn wá ń bì. We give you, and if we don't give you, we don't know what. So you are forced doctors to also get used to giving you. Do you understand what I'm saying? So oftentimes, most time, all you need is maybe paracetamol, hydrate well, take cough syrup, and rest, and you would have been fine. Do you understand? And last but not the least, the issue of beans, bread, coconut in the stomach, right? It could be an allergen. It's possible that there's an allergy in some of those food substances you have mentioned. Who Who asked the question? Okay. So it's possible there are allergens in it. And it's possible, as well when you mentioned beans, also one bed. Thermo. Do you understand? Because some food items tend to precipitate or exacerbate ulcers. And from experience, beans is one of them. Do you understand? There will be some pain, not all ulcer. The fact that your H. pylori test is negative does not mean it's not ulcer. Because medications can cause ulcer, like aspirin, ibuprofen, diclofenac, and fervin that women use for menstrual stuff. It can cause ulcer. Prolonged use of steroid, prednisolone can